Medical Tourism Corporation interview with Dr. Manoj Rajan, Director of Dr. Smilez Advanced Dental Center, India, expert prosthodontist, implant and mouth restoration. Dr. Rajan is an international lecturer and educator on dental implants and has over 20 national and international publications. Dr. Rajan is also a visiting faculty member at the University of Frankfurt in Germany.
I'm Dr. Manoj Rajan. I have my specialization from Chennai, where I did my undergraduation, and then went on to do my post-graduation in prosthodontics from Chennai, and I also happened to do my diplomate at national boards, again in prosthodontics. Having undergone many years of education in prosthodontics, it's just natural progression for me that I had to do something in implantology. So since we lack a training program in India for implantology, I traveled abroad, where I worked with great doyens in implantology at Sweden, like Professor Branemark, who's really the father of modern implantology, and with Professor Spiekerman at the University of Aachen. Having been there with them, learning with them for years together, and I decided that practice of implantology is going to be my specialty. And I have for the last 15 years or so worked on the specialty, and not only in the clinical aspect, but also in research, also in lecturing, where I lecture for various organizations. I also lectured for the Nobel Biocare World Tour, where we had the opportunity to meet with a lot of speakers from throughout the world, and it was a great meeting. I also lectured at the ICOI, which is the International Congress of Oral Implantology at Orlando last year. So very happy and have had a very fruitful time in this field. We have the first advanced dental center at Chennai, located in the IT corridor, which is called as Perambudi. And this center was started with a vision of providing the best global practices, the best global treatment approaches to patients. We're also specialists in sedation dentistry, which is really the painless form of dentistry which is practiced in the West. We're one of the first centers in India to introduce sedation dentistry. Most of our implantology cases and surgical cases are done with the help of intravenous sedation, of course with a sedationist who's certified to do this work. And we are one of the best in implantology too. We have a great implant team. I think it's got the largest number of publications in implant dentistry from India. A team of prosthodontists, surgeons, and dental technicians. I have to give credit to the dental technicians because they put the teeth on. So we have dental technicians who are trained from Germany, who really give you the best dental work. So this combination is a great mix, and we've had great results. The way we work at Dr. Smilez is a kind of approach like you would have in the West. Right? We have a team of consultants, we have a team of general dentists and specialists who would review each and every case. It's a kind of team approach what we follow, because that's the only way that the patient can get the best treatment. Single person would have to do a lot of multitasking and would actually hinder the quality of dental treatment. You will first be seen by a general dentist who would review your case, talk to you about various treatment options, explain to you in detail about the cost, and then we would have a team approach where you will be put on to the concerned specialist. When it comes to interdisciplinary kind of approach, for example, implantology, when we have a team of surgeons and prosthodontists who would treat you, and so that there's this likelihood for failure. We believe that specialists are there to do their job, and we firmly don't believe in a single individual doing all the dental work as it happens sometimes. But yes, being a clinic that where we focus on advanced dental procedures, it's very, very important to have very strict sterilization and disinfection guidelines. In short, it's a kind of process where we kind of separate the instruments which are going to be infected, so it's going to have blood, and another instruments which are not going to be having any blood on it. And then it goes through stages of disinfection and sterilization using vacuum autoclaves. We also have color indicating packaging where it would kind of change color in order to denote the right kind of sterilization level has been established. And so this has been a very good method, and with this kind of approach and also rigorous training of our staff with these using these new techniques, we also upgrade our sterilization technology whenever there is something new that comes up in other parts of the world. With regard to what happens at the clinic level, we follow barrier protection methods, which include barrier tapes and drapes. They're all disposable, and we change them for each and every patient, so it just prevents cross-infection in protecting the patient and protecting our staff from any sort of cross-infection. And this starts with having good ergonomically designed dental chairs which are going to be comfortable both for the patient and as well as for the dentist. We have adequate protection by way of drapes and safety glasses, and this would prevent splatter kind of infection. And on the other side, we also believe in not overstressing our staff into working in improper positions. So we train them in all these steps. It's not voluntarily necessary in India, but we want to set a benchmark and a guideline for this. So we try to follow this. We have our own fire safety drills. We have a team of specialists who come and teach our staff on fire safety. I think we are setting our own standards in India with regard to this. Most of the chairs that we use have the latest technology in them, which in addition to patient comfort has an inbuilt mechanism where there is no retraction of fluids. This is important in order to prevent cross-infection which results as biofilm formation in the older chairs. And we also go a little further, that we have the newer chairs that also have a disinfectant which goes through the tubes, so that further prevents biofilm formation. And most of the water what we use is sterilized from our reverse osmosis plant that we have in the center, so which again greatly reduces the infection levels. We use, to name a few of the latest technology, we use computer guided implant dentistry approaches, which is really the cutting edge in the world. Some of the best. So where you plan beforehand, before doing the dental implant, where with help of special software. In addition to this, this is sort of the major pluses. Then you have the digital technology for X-rays, and you have bleaching solutions. You have special instruments, gadgets for doing effective root canal treatment, if you want to say, and we have our labs doing CAD/CAM crowns. These are computer designed crowns. So we do most of the latest. Oh yes, most of our team members have a lot of international experience and exposure, and they travel quite a lot. Many of them are also on the panel of lecturing on various companies like Noble Biocare or other organizations. Yeah, I think if you were to consider implant dentistry as a benchmark in clinical success, we have done over 3,000 implants and have had a success rate of over 96%, which I feel is among the best in the world. And as you're aware, clinical dentistry is a lot different from university-based dentistry. Right? We don't take the best patients and do implants on them. So with current lifestyles of patients having diabetes and osteoporosis, I think we have very, very good success rates, the best that we can do with dentistry today. So we had patients from various parts of the world coming in for treatment at Smilez, right? From I think from US, from UK, from Singapore in Asia, from Korea, as Chennai is now the hub for a lot of Korean companies. And I'm happy to tell you that they've all had favorable treatment done. We have a good follow-up system where we follow patients even after they have left from the treatment in India for many years, and we have very strict quality control audit guidelines. We don't have, most of the patients would be looking at long term. We would like to work long term with patients. We don't want to be in a situation where you come to India and you have treatment done and then you go off and then it's a kind of disconnect. So we even call patients up and ask them about their well-being, and based on this feedback I can tell you that we've had a very good response, and I think the more number of patients coming in is just proof of that. We give all our patients a 10-year guarantee on implant work and a 5-year guarantee on all our prosthesis. This they get in the form of a guarantee card, and within that period, they obviously get a free replacement in case if something goes wrong. Because of a strict audit facility where all the patients are actually given with a CD of all their x-rays and photographs what we take. We have very less post-operative complications. But having said this, it's science, and there's never 100% success rate in science. But we try to give patients all their records, and including the photographic treatment and the X-rays, before and after X-rays, so that when they get back to their countries, in case there is a problem, there is a clear understanding of what's been done. And we also have a 24-hour helpline where the patients are either through the phone or through the internet, and we have a totally transparent system where either the patients or the dentists can call us up, and we'll be happy to help them out with whatever concerns they have. Finally, I would like to tell all of our international patients they will have a very, very favorable experience.
Medical Tourism Corporation facilitates affordable medical treatment at world-class international hospitals. Fill out the estimate request form on our site for a free quote and more information.